While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. Hey guys, welcome to another episode of the Boss Body Podcast. I'm your host, Dr. Tim Jackson. Today I have yet another very special guest with me. His name is Dr. Anshul Gupta. He's a best-selling author, speaker, researcher, and the world expert in Hashimoto's disease. He educates people worldwide on reversing Hashimoto's. He's board certified in family medicine with advanced certifications in functional medicine, peptide therapy, and a fellowship in integrative medicine. He worked at the prestigious Cleveland Clinic, Department of Functional Medicine, alongside Dr. Mark Hyman. He's helped thousands of patients to reverse their health issues by using the concepts of functional medicine. He's now on a mission to help 1 million people reverse their health conditions. To achieve this mission, he has written a best-selling book called Reversing Hashimoto's. He has also started a virtual functional medicine practice, a blog, a YouTube channel, and podcast, so he can reach people from all over the world. And recently, he hosted a Reversing Hashimoto's Summit. Welcome, Dr. Gupta.
Dr. Jackson, thank you so much for having me on the show. It's a pleasure and a privilege. Thank you for doing what you are doing. The show is just amazing.
Oh, thank you so much. We're excited to have you. I mean, you did a family medicine residency. Can you tell us a little bit about when you were in medical school and in residency, did you have an interest in functional medicine or what garnered your interest in it?
So luckily, I got into this residency program, which did had integrative medicine in residency. So this was a program which was done in collaboration with University of Arizona, and they were introducing the concepts of integrative medicine in very selective residencies across the country. And luckily, I was one of those. And initially, my mentor was integrative medicine, but then, halfway through my residency, there was a functional medicine mentor that joined. So she also introduced me to functional medicine. But then, the time was not enough. In family medicine residency, you're just running, to complete all those hours. There is no dedicated time given to you. So whatever you do, you have to do it in your free time. So I just got introduced, but then, when I graduated, there were not many kind of practices or jobs into functional medicine. So I joined like a typical family medicine private practice. What happened was that like a couple of years into my practice, I started having some health issues. I started gaining weight. I was feeling very tired during the day. I even had to take a nap during my lunch hour just to complete my day. By end of day, I was actually so much brain foggy that sometimes, I was not able to pay attention to what my wife was saying, or I will forget things. I actually started having this horrible stomach pain. Out of nowhere, suddenly I will just get stomach pain, and I had no idea what was happening. I started taking medications like antacids, PPIs, a whole bunch of things, but nothing was helping. I was a physician doing kind of all kinds of things to help me out. Nothing was changing. I even went to all these different specialists, did all the different tests, endoscopies, blood works, ultrasounds, food sensitivity tests, everything was negative. And I was like loss of words. What should I do? I was just 32 and I was taking more than 5 medications just to combat these things. Nothing was working. That's where I remembered, well, I kind of, got exposed to functional medicine. Maybe that's where I have the solution to. So I actually got, fully trained into functional medicine and started making a protocol of my own for myself with some lifestyle changes, with taking, some supplements. Within 1 month, my stomach pain was gone. Within 6 months, I lost more than 40 pounds. I had more energy in my life that I ever did. I even actually participated in a 5K rugged maniac, and I was never an athletic person in my life. I was able to reverse my eczema. I was able to reverse my fatty liver. Obviously, my brain function got so much better. So that was like a big aha moment that, within few months of doing functional medicine, my whole life changed. So I need
Wow.
to share this with people around, and I can definitely help so many people around with it. So that started my journey of functional medicine, and then I started helping people through that.
Absolutely. Well, that's a really inspiring story. Tell people all the time that you see a lot of traditional allopathic doctors going from allopathic medicine to functional medicine, but I've never seen one go from functional medicine back to allopathic. Not one.
That is true. That is true. I never actually thought about it, but that is so true. Once like, there's a saying that, once you are aware, like, okay, what is right and what is wrong, then it is very difficult to close your eyes towards what's going around you. And
Right.
that's the similar thing that once you are aware that, this functional medicine is the right way of doing medicine, you just cannot go back to doing the conventional stuff anymore.
Yeah, you can't unlearn it for sure.
Yeah.
And so, as part of your health journey, did you have Hashimoto's or elevated thyroid antibodies?
So actually that happened to me more recently. So I just, like was feeling very, very hot, like, for some amount of time, feeling a little bit anxious, and mood changes were happening. And obviously, again, I did everything, any testing, and everything was negative. And my thyroid levels were like, totally off the chart at the time. And then just before that, I actually went through a viral illness. So we figured out that maybe those viral illness triggered my Hashimoto's, or my thyroid issues. Now, the good part was that obviously I caught it very early phases and I knew how to take care of it. So I did, again, change my lifestyle, again, kind of, start working on my immunity and then took those supplements. And luckily, I was able to take it back to normal. And I keep checking everything. And luckily, everything has been okay. And I don't take any medicine. So that way, I was more on the luckier side than all of our patients, that I was well aware of what was going on with me and I was able to take action very early. But yes, like it was just recently I went through the thyroid issue.
Yeah, absolutely. I mean, you touched on a great point with the infections. I mean, I think not everyone, but almost everyone walking around today has, at least two or three pathogens. They're not, at the point where they have a 103-degree fever and they're on the couch, but they might have anxiety or brain fog. And I think, we don't look at viruses as affecting the brain, even though they do. They activate the microglial cells and, attack the thyroid gland. So then that's going to, take everything offline, since every cell in the body has a receptor for thyroid hormone. And so if you don't, I mean, you don't have to share exactly the name of the supplements, but what's your general approach in terms of lowering viral load or total pathogen load?
So again, actually, we do work on mainly an underlying immune boosters. That's what I call them. Like a long time ago, depending on viruses they have, we do modify our plan slightly. But in general, our goal is to start working on their gut immunity, because that's where, like a lot of our immune system hosts around 70% of immunity in the gut. So that's where we work on. Then we work on, again, improving the disease process by changing the Th1 and Th2 response in their body, which is the typical response, which again leads to inflammation and autoimmunity, and which again helps with the immunity. So in that aspect, sometimes, we use a lot of omega-3s to help immunity. I'm a big fan of curcumin or turmeric, which again helps with improving the immune processes. Sometimes we use different kind of mushrooms, again, to boost the immunities. Certain herbal things like blends of things, especially Byron White is one of the blends that I use in a lot of my clients, depending on whether they have Lyme, whether they're Epstein-Barr, which has again helped a lot. And then, our typical supplements like zinc is also helpful for boosting the immunity. Vitamin D is good for immunity also. So all of those things, like we use on our clients. And then obviously food, right? We've lot of different food plans we have, which include foods which reduce inflammation, and again, foods that boost the immune process. So those are the typical things that we use, along with some vitamin C, which again kind of help a lot of people with their immune boosters.
Yeah. So just for our listeners, what Dr. Gupta is referring to with the TH1, TH2, if you haven't heard it before, it's T helper 1, T helper 2. There's another one, TH17, but in general, you want your immune system to be able to oscillate back and forth. Most people get stuck in a TH2, so then they start accumulating intracellular infections, and things like glutathione. They're so important because it keeps you more towards a TH1, able to fight off those infections. And I know when glutathione gets depleted, not long after, the thyroid goes offline because A, the viral load goes up, but B, the thyrocytes, cells of the thyroid, are very sensitive to oxidative stress, correct?
Mm-hmm. That is true. Yeah, that is again a very big mechanism, especially in Hashimoto's patients, that their oxidative stress markers go completely crazy, because every time thyroid hormone is being produced, that it creates some amount of oxidative stress, right, in the body. That's kind of the enzymatic process which is happening. But then, because of other things, as you mentioned, chronic infections or toxins in the body, the oxidative stress release very high. And interestingly, some of the thyroid patients have a genetic SNP which actually doesn't let their body produce enough glutathione levels too. And they have no idea about it. And we know that glutathione is the master antioxidant. It helps with detoxification, reducing inflammation, whole bunch of things. So slowly and slowly it reduces. And that's the reason our body is not able to fight off with this oxidative stress. So glutathione definitely helps out with not only reducing inflammation, helps with toxins, obviously helps as an antioxidant detoxifier. So one of the supplements which I love a lot in my clients.
Yeah, absolutely. I mean, glutathione is such an important supplement, and most people know it as an antioxidant. They don't necessarily know the immune modulating properties of it. And so I think that that's, oftentimes overlooked. In terms of medication, one question, and I'll be honest, I take this myself more so prophylactically, but low dose naltrexone, I've taken since 2009. And for listeners, when we have an infection, it doesn't just create an immune response, it's a neuroimmunological response. That's why you get brain fog, you don't really want to socialize, because those cells share a lot of the same receptors. And so, do you use low dose naltrexone?
So I used to do it a lot, like previously in my practice. I have not recently done it so much. Initially, like there were some very promising studies of low dose naltrexone, especially helping Hashimoto's and autoimmune clients by, as you mentioned, working on these opioid receptors, reducing inflammation, boosting the immune processes. We were not seeing that great of a result, in terms of clinical aspect. When I was at the Cleveland Clinic, we tried it like, at least in 10, 15 patients, and we just watched them closely to see if we can see the markers going down. And just with LDN alone, we were not seeing that. Obviously, that's not the right way of looking at things. In functional medicine, we don't want to do things alone. It's like a combination of things.
Right.
But like I think the good part about LDN is that there is no downside to it, right? It's a pretty safe supplement, like no side effects to it. It is helpful with literally everything. It can be helpful for cancers, for chronic infections, for Lyme disease, for autoimmune conditions, you name it. Like LDN is helpful for it. So some people who are already on it, they continue to use it, or I continue on them. But like I have found other supplements, because sometimes it becomes very difficult for people to take 10, 15 pills or capsules in a day. So
Right.
sometimes we have to prioritize them, into things which I feel is going to help them based on their root cause, what is going to help them the most. And then for long-term basis, I sometimes suggest them, okay, if you want to use LDN now for the long-term basis, you can, just to kind of keep your immune system in healthy shape.
Yeah, absolutely. So I think that's great because LDN, and this applies to pretty much any therapy, if it's used as a standalone monotherapy, you may see marginal results because, again, there's multiple root causes. And so I think it can only help. I mean, I think it's definitely worth a try given the cost and the risk benefit ratio. But what are you seeing in terms of common gut infections leading to Hashimoto's?
Oh, so the gut infections, they are all hosts of variety of things. So the first thing is that there is a good connection between Hashimoto's and SIBO, which is a small intestinal bacterial overgrowth. So we definitely see almost like 70 to 80% of my clients with Hashimoto's will have SIBO in their gut, which is an overgrowth of bad bacteria. So that's one thing. The second thing we also see is SIFO, which is small intestinal fungal overgrowth. So a lot of Hashimoto's patients will have underlying Candida growing in their gut, which obviously they had no idea about. And we all know that Candida is such an immune modulator, which definitely has been associated with Hashimoto's. The third thing is parasites, especially blastocystis. Like there has been a couple of research studies which does say that blastocystis can trigger Hashimoto's. And interestingly, with treatment of blastocystis, the antibody levels of those patients went down. So that's the third thing, that in parasites we do see blastocystis. Other parasites are not so common, but blastocystis, Candida, and then this SIBO is very common infections that we see from the gut aspect.
Yeah, and Candida for a while. So I use a few different stool tests, but I knew people based on their symptoms and their history that they had Candida, but it wasn't showing up on stool tests. And I realized it was typically getting fermented in the small intestines. So by the time it got to the large intestines, it was pretty much undetectable. Plus, it has the hyphae that allow it to dig into your tissue. And so, and the last thing I'll add is Candida can split your secretory IgA molecules in half. And that's the molecule that controls your mucosal immunity. So in your nose, your mouth, your gut, all those things. And so Candida, yeah, it can wreak havoc on multiple fronts and certainly contribute to brain fog.
Absolutely. And you correctly pointed out, we were having such a tough time to even diagnosing Candida because there is no perfect test, that will not miss Candida. And a lot of times until you find it, it's very difficult to convince patients that, okay, well, Candida is your issue when a test says this is not. So sometimes we use a combination of testing, as you might already be doing. Along with the stool test, we combine organic acids and sometimes blood markers also, so that, we are making sure that we are looking at for Candida from all different angles. And sometimes just based on the symptoms, you're correct in saying that Hashimoto's brain fog is such a major problem, and Candida definitely is one of the major triggers, because Candida and mold again go very hand in hand too, right? So that's the reason anybody who comes from brain fog, we are putting them, or at least, for a short amount of time, on an anti-Candida protocol, see amazing results. Their brain functioning gets so much better. They feel so good. So obviously testing is difficult, but if you combine the testing, great results. But even then, if you just go on an anti-Candida protocol, I think that's a reasonable approach of treating Candida.
Yeah, I mean, it's kind of a double-edged sword because, people eat too much sugar that causes Candida to grow uncontrollably, and that causes them to crave more sugar. And so you got to break the cycle. Otherwise, it just looks like they don't have very much willpower when that's not the case at all.
That is true. Yeah. Candida is such kind of, one of those things. And the problem is that people have no idea, like most people are not even aware of Candida infections in the gut, right? They might be aware of, okay, fungal infections on their skin, but beyond that, most people have no idea about that Candida infection can live in the gut. And all of these symptoms like sugar cravings, like brain fog, like weight issues, hormonal imbalances, a lot of immune issues, a lot of people will have like, UTIs and all the other things. And the underlying issue can be this Candida, which is just creating an havoc on their immune system.
Yeah, absolutely. And like you said, mold, I like the organic acids test as well, because you can get some indication of the presence of mold and mycotoxins. And, where you have mold, you're going to have Candida. And you really won't be able to get rid of the Candida until you address the mold, in my experience. But they both produce oxalates. Do you look at oxalates much?
I have been started looking those, before initially, like I thought, oh, well, oxalates are just coming from, like food, like, people are eating a lot of greens or other things. Or, I just need to worry about oxalates because they form kidney stones or anything like that, or gallstones. But recently, when I started digging deeper, then I realized, okay, well, oxalates actually is another marker, as you said, of either Candida or, mold or underlying inflammation that is telling the body that, that still needs to be addressed. So I'm following that closely, and people, those are high. Definitely, we look for other root causes which are leading to those high oxalate levels. So certainly part of the panel that we also ordered that, checks the oxalate levels, and we are paying close attention to it.
When you check thyroid levels, what markers are on or included in your typical panel?
So typical thyroid tests, like we are doing our TSH, free T3, free T4. Then we are doing the antibodies, the TPO, the thyroid peroxidase antibody, the thyroglobulin antibodies. Sometimes, depending on situation, if you're able to get reverse T3, we add that also. A lot of labs are not able to do it correctly. So, like if we have the facility to do it, we get that also. Then we order sometimes inflammation markers like, HSCRP, ESR, just to see how much inflammation is ongoing in a person's body. Those are the typical things that we order from the thyroid aspect. And then, then goes the functional medicine aspect of what else is going on inside the body. That's what we order.
Absolutely. And do you find that with the approach of addressing multiple root causes, you're able to, in many cases, avoid thyroid medication?
That is correct. Well, it actually depends, on what stage the person comes to us, right? A lot of people, that comes to see us, have had Hashimoto's for like 10, 15 years. And then by the time, we do see some thyroid destruction and thyroid scarring. For those people, who are taking like 100 micrograms or 120 micrograms of thyroid medicine, very difficult to get them completely off the medicine. But if people come to see us in early diagnosis or on a very low dosage of the medicine, like 25 or 50, those are the people definitely we are able to get them off the medicines. Or people who are coming into early diagnosis that they have not yet started the medicine, then certainly, like with our protocols, they don't have to go on a medicine. And obviously, plus the thyroid is safeguarded that it doesn't continue to get destroyed.
Absolutely. What role does stress mitigation and management play in optimizing or reversing Hashimoto's?
Oh, it's like the central role, like I cannot just, each and every client that I see, I just stress so much that stress management is the key. Unless you work on that, nothing is going to get better. Now, as a society, I think, whenever we talk about stress management, people feel that we are labeling that they themselves feel guilty that they are causing this Hashimoto's by just being anxious or not able to handle stress so much. And I want everybody to know that is not true. We all get exposed to stress, and stress does things into our body. It changes our anatomy, it changes our physiology, it changes our hormonal levels. So that's what we are talking about when we're talking about stress management. Stress management techniques easily can reverse those negative aspects of things that stress has already done to your body. Stress management things is going to improve your immunity. It is going to help rebalance your hormones. It is going to help improving the inflammation in the body. It is going to help in reducing those antibodies. It is going to help with your energy, going to help with your brain fog. I can just keep going on and on. It is going to help with literally everything. So that's the reason. And I tell everybody, and that's the thing which is for free, right? Yeah. There is no cost of doing meditation. There is no cost of doing deep breathing. So very easy things to do, and it's going to be helpful for a long-term basis. So I do believe that stress management is a very important key. Each and every Hashimoto's patients should be going on it. They definitely, each and every hour Hashimoto's patients go to this stress management training and techniques, and we see phenomenal results. And each and every person always comes back saying, Dr. Gupta, I've heard everybody talking about this supplement, that supplement, or this therapy and that therapy. But I think the most helpful thing for me was going on the stress management techniques, because that has made a world of a difference. So I think very, very powerful tool.
Do you use HRV, heart rate variability, or meditation?
We use all different kinds of things. Again, depending on person to person, because some of the people that come to see us are like very type A personality, right? Those are like get goers. Those are the people who are like, exercising a couple of hours every day or running like 10, 15 miles every day. And then for them to sit in a place and do meditation is very difficult. That's where I think, the HRV is useful because, they can actually interact with HRV, and that gives them responses of how they're doing by kind of having them in that, window of where they should be, right? So that's where like HRV it is more interactive and things. And then introducing them, to deep breathing techniques, again, easier for them to do it. And then, like sometimes we get people which are much more calmer, which are already introduced to these concepts. Then we know we can go with meditation with them directly because they're ready for it. So I think depending on person to person, we kind of, offer all of these things, whichever person likes it or whichever they can do.
Right. What are the first and what are the most important signs and symptoms of Hashimoto's?
Well, actually, so a lot of times we miss the early signs and symptoms of Hashimoto's, according to me, which I feel. But a lot of the times it might be the weight changes that people feel that, they are not unable to lose weight and suddenly they are gaining a very, very slow amount of weight. The second is a sign is a fatigue or tiredness, that they are getting a little bit more tired as compared to before. Now everybody kind of labels that to, okay, well, maybe, like it is because now you have kids or it is just because of your age. But I think that's a very important subtle sign that body starts telling us that you have inflammation and you are, getting more tired. Then the other thing is cold intolerance, making a shift into your body's temperature, that suddenly you're feeling that that your body is intolerant to cold, or there is a shift in the body temperature. And then skin changes, skin becoming drier than usual, or hair changes, that hair are becoming thinner, or there is loss of hair. And then the other thing is the mood changes. A lot of females or males starts having mood changes or becoming a little bit more anxious than usual, or feeling a little bit more depressed. Again, everybody feels, oh, I'm going through maybe just midlife crisis, and that's the reason my mood is changing. But in reality, actually, it might be the Hashimoto's which are causing these issues. And the last thing is the gut. A lot of people, again, they see a shift in their gut pattern, and sometimes they become more constipated. They have a little bit more gas, or they feel more bloated. So those are all the signs and symptoms that people with Hashimoto's are going through. And oftentimes they're so subtle that people miss it. So I always tell people just pay very close attention to it. And the test is very simple. So you can just go to any local doctor of yours and ask them to do these tests, but ask them to do the antibodies, because a lot of times that's what they are going to miss. They're just
Right.
going to order this TSH, and that is not going to check the Hashimoto's, and they get often kind of misdiagnosed, with just having normal thyroid.
Yeah, I've had a hard time understanding why they're checking a brain hormone. It's not even a thyroid hormone, it's the communication between the brain and the thyroid. And then, you have the free levels of the hormones, but then the antibodies are looking at any immune response. And so even if your free T3 levels are good, if your antibodies are high, it's going to negate that, correct?
That is true. Like a lot of now patients, like after listening to me here and there, come to see me and they said, well, we went to this doctor and we thought it has been normal, but we asked him to check the antibodies. Now my antibodies are high, but my T3 and T4 levels are fine. And he said, you are okay. You don't have anything. You might have Hashimoto's. Don't worry. Just go home and chill and relax. And then when we were asking them, well, what else can we do? And they had no idea what to do. So they said, that's the reason we are here. Should we do something? And they said, absolutely, you should be doing something, because these antibodies are soldiers which are destroying a thyroid gland day in and day out. So you are lucky that you got diagnosed at a very, very early stages, stage 1. So if you do things right now, you can actually reverse this condition very, very easily.
Absolutely. Absolutely. So we know that the thyroid and the adrenals go hand in hand. Do you evaluate cortisol rhythms in your thyroid patients?
Yeah, some of the thyroid patients, if they are willing to invest, in this test, this is a very great test, the salivary cortisol test. So sometimes, we have the Dutch test, which also does it for us, which evaluates the cortisol rhythm, 4 times in the day. Very important thing, because as you said, the cortisol and thyroid hormone are very well connected. Once your cortisol is off, it is actually going to not let your tissue even utilize the normal amount of thyroid hormone which is running in your body, which we sometimes call as thyroid resistance, which is happening just because your cortisol levels are so high. And when your thyroid levels are too low, it actually doesn't let your adrenal glands produce enough cortisol levels, which again causes a lot of issues, because of low cortisol issues. So they're both very well connected. So definitely, like for me, the whole endocrine system is like a symphony.
Mhm.
Each and every instrument in the symphony is connected to each other. If one is not working, the whole symphony is not going to sound right. So
Exactly.
that's the reason, like we definitely pay attention to all the hormones, especially the adrenals. One of my favorite glands that we want to look at how they're functioning, because we need to fix the adrenals. Unless the adrenals are fixed, the thyroid is not going to get better, and vice versa. So definitely it's like brother and sister relationship that we have to get them better together.
Yeah, and I've kind of developed over the years a pyramid of how I address hormones. Sex hormones are at the top. Everyone's interested in those, but you can go on testosterone replacement or estrogen bias, progesterone. But if your cortisol, thyroid, and insulin are not in balance, then the sex hormones won't work.
That is so true, Dr. Jackson. I cannot believe that there's so many functional guys out there. The first thing they're looking for is that for their clients to get started on, like, either estrogen or testosterone. That is your problem. And that's the reason there is a big surge in people who are doing so many hormonal injections or like using these creams each and every day. And their thyroid and cortisol is like down the dump. Nobody's bothered about it. Oh, well, just, get your sex hormones in good place. You feel good and we don't have to worry about anything else. But it's so important. You said it so correctly that until we address the root of the pyramid, which is your thyroid and cortisol and insulin, the sex hormones are not going to get better. You will just replacing, with what we call as green pharmacy. You're just giving them hormones, but they're not going to be finding the right solution. So very important. Again, I'll tell everybody, I'm not against hormones. Yes, some people, they need it. There is a place for it. But let's start working on the real thing, which is your cortisol, which is your thyroid, which is your insulin. Without those, nothing in the hormone system is going to get better.
Absolutely. And do you have, as part of your lifestyle medicine program, have people focus on getting more time out in nature, more direct sunlight?
Absolutely. Again, yes, like always tell people, like, this is your time to take a moment and then kind of be with yourself. Because most of us, we are just always on the go, go, go. Like, okay, well, we want to get to our workplace and then come back home, take care of the kids or take care of the house, right? We are just so busy. Even on the weekends, we just have planned things which are always indoors, right? But we know that there is so much power in grounding, right?
Mhm.
When you are outside in the nature, you actually feel the ground. Those electromagnetic radiations, or the waves that you get from the grounding is so amazing, so nurturing. Same with the sunlight, right? The sunlight gives you, not we just feel that okay, just going to give us vitamin D, but no, along with vitamin D, it gives us so many other healing properties that we always want to do. And most of us, always are indoors, right? Our buildings are not environmental friendly at all. They do not let any sunlight in our buildings, right? So our workplaces are all dark. We're using always those artificial lights, right? So definitely a very big push. I always say, well, go outside, do whatever you like, whether you want to run or jog or just spend time with family. Do picnics outside, like, so those are all great things. So yes, absolutely. Those are part of a program.
And again, it's free. So what
Exactly.
more can you ask for than that?
Yes.
If you had to pick one or two things that you know today that you wish you would have known 8 to 10, even 12 years ago, what would you say those things are?
So first of all, I would like to share with people is that don't let anybody tell you that, you have to live the life that you're living right now for rest of your life. There is a good quality of life ahead of you. Just the age is just a number, or disease is just another label on you. You can get your life back if you do the right things. It is not complicated. That's the second thing I want everybody to know, that there are certain simple things, like that you can do on your own, like changing your how you eat, changing how you process stress, just kind of changing your environment. Those can be life changing. You can do those things. But if they're not working, then yes, you need to start looking deeper.
Right.
And that's where you need a comprehensive approach, where don't again stop at just one particular thing, like how you and me were discussing just before we started the podcast. Is a lot of functional guys will stop at, okay, well, I found your root cause and this is the root cause. We are just going to do heal this and you will get better. Nothing happens, right? Because most people once they are at that stage where they're feeling miserable, there are at least 2 or 3 root causes which are combined together playing a role. So you need to find all the root causes, address all of those things. But then once you have addressed all of those things, you are certainly going to feel better.
Absolutely. Well, thank you so much for joining us. You're a wealth of knowledge. How can people reach you if they want to work with you?
Well, they can reach me on my website. So our website is anshulguptamd.com, which is spelled as ANSHULGUPTAMD.com. We have a great YouTube channel. Anshul Gupta MD is the name of the channel, where we have a lot of people interviewing and a lot of information are shared. They can always get my book called Reversing Hashimotos, which is available on Amazon through Kindle or like paperback all over the world. So all different ways. I'm on social media, so people can follow and just kind of learn from what I want to share.
Awesome. Well, thanks so much for being here, and hopefully we can have you on again in the future.
Absolutely. It was again a pleasure being over here. You're doing an amazing work. This show is so great. A lot of good information I have learned already with some of the shows that you have done.
Thank you so much. And thank you for the work that you're doing and the millions of people you're helping.
Thank you again.